Now to examine the throat. So sometimes you can get the command to examine the neck and sometimes you get the command to examine the throat. So there is only little difference. Rest of the steps will be the same. So I will tell you the difference. So starting again, you have to introduce and take consent. अच्छा, मेरा नाम डॉक्टर मुमताज अहमद उमर है. मैं नाक कान गले का स्पेशलिस्ट हूँ. तो मैंने आपके गले का मुआयना करना है. क्या मुझे इजाजत है? जी. So the consent, introduction and consent has been taken. Now the position. Patients and the doctor level should be at the same. And for the same gender, we can sit like this. Or with opposite gender, we have to be on one side. Our legs should be on one side and the patient's legs should be on the other side. Okay. Remember one thing. If you have been given a task to examine whole of the ear, nose and throat, then you have to take consent only in the start of your examination. Otherwise, if you are given different patients or different individual tasks, then you have to take consent of that. So we will start with the inspection. So starting from the vermilion border and angle of the lips, the vermilion border, upper and lower, just a glimpse of the neck. अच्छा, थूक पेट में लेके जाएं. ठीक है. बांध बाहर निकालें. इस साइड पे लगाएं. इस साइड पे लगाएं. ऊपर तालू से लगाएं. मुंह खोलें. ठीक है. बाहर निकाल के आ की आवाज करें. ऊपर देखें. आ बोलें. So with this inspection, we have examined the hypoglossal nerve by checking the movement of the tongue. And again, when the patient say ah, we have to see the mobility of the soft palate. So the ninth nerve is also checked like this. Now we have to do the examination with tongue depressor. First of the oral cavity and then the oropharynx. You can either take one tongue depressor and check whole of the gingival surfaces and buccal mucosa, or more easily or conveniently you can take two tongue depressors. So we will do it with the two tongue depressors. So start doing it. मुंह बंद रखें आप. नहीं, टाइट नहीं, हल्का सा. So along with the simple gingival surface, lower this side, then above. ऊपर देखें थोड़ा. All the gingival surfaces on left and right side. मुंह खोलें अब. Now examine the retromolar trigone area, buccal mucosa. आप बोलो. Important thing while examining the oropharynx, that tongue should remain inside. You cannot pull out the tongue and then depress it. टंग को अगर बाहर निकाल के उसको डिप्रेस करने की कोशिश करेंगे तो सही तरह डिप्रेस नहीं होगी, क्योंकि ऑलरेडी स्ट्रेच होती है. तो टंग को जब भी डिप्रेस करना है वो जुबान मुंह के अंदर रहनी चाहिए. आफ्टर दिस द नेक्स्ट स्टेप, especially in those patients if you find any swelling in the floor of mouth or in the upper cervical region or submandibular area, you have to do bimanual palpation. अगर कोई स्वेलिंग मैस नहीं लगा नजर आया तो आपने जिक्र जरूर करना. यू हैव टू इन्फॉर्म द एग्जामिनर दैट सिंस देयर इज नो मैस और स्वेलिंग, सो देयर इज नो इंडिकेशन ऑफ परफॉर्मिंग बायमैनुअल palpation. लेकिन अगर एग्जामिनर कहता है नहीं आप परफॉर्म करें, देन यू हैव टू परफॉर्म इट. सो टू डू bimanual palpation, either wear a glove or take a gauze piece on your two fingers. मुंह खोलें. Put your one hand in the submandibular region. मुंह खोले बेटा. जुबान ऊपर. And palpate on one side and then repeat the test on the other side. So if there is a mass and you feel while pressing above and below you feel it is palpable, then it means it's a submandibular gland. But if it's only palpable on the outside and not inside, then it is a lymph node. Now the next examination step is indirect laryngoscopy. For indirect laryngoscopy, we need an indirect laryngoscopy mirror. So this is an indirect laryngoscopy mirror or the straight mirror. The other mirror is the posterior rhinoscopy mirror, which is a step up mirror. This is used for posterior rhinoscopy, which is a part of nasal examination. And this is indirect laryngoscopy, which is part of laryngeal examination, throat examination, or neck examination. Okay. For indirect laryngoscopy, we need gauze piece, and again we have to heat the mirror end to prevent the fog from coming on the mirror. So now I will explain the procedure to the patient and then we will perform it. मैं अभी इस शीशे से आपके गले के पिछले हिस्से का मायना करूंगा, ठीक है। इस शीशे को मैं थोड़ा गर्म करूंगा ताकि भाप ना जमे, तो मैं आपको चेक करा दूंगा. So we will heat the mirror end and check on the back, check the back side on the back of our hand, and when it's normal then ये देखें गर्म नहीं है ज़्यादा, ठीक है. Then we will take the gauze piece. ज़ुबान आपने बाहर निकालनी है. शाबाश, मैं आपकी ना ज़ुबान को इससे पकड़ूंगा. Hold the tongue between thumb and middle finger and lift the upper lip upward and lift the uvula. आप बोलें बस. So two things we have done while passing it backward, lifting the uvula up. We have checked the laryngopharynx, and by asking the patient to pronounce E, we check the mobility of the vocal cords. So these 2 points are very important while performing indirect laryngoscopy. After indirect laryngoscopy, as I mentioned, the difference for neck examination. In neck examination, we have to check the centrality of trachea, which is not needed in throat examination. But if you have been given the command to examine the neck, then we have to check whether trachea is central or no. आप ऊपर देखिए जरा. So place the index and ring fingers on the two clavicular head and use the middle finger to check if trachea is central. After this, we will proceed towards the lymph node palpation. Go on the back side of the patient to perform the lymph node examination. To check the lymph nodes palpation, it shouldn't be done on both sides simultaneously. One side should be done at one time. Why? Because we have to flex the neck to one side. So we will do, there are two basic groups, superficial and the deep group. Superficial groups we can do it simultaneously, like the first is the preauricular, postauricular, occipital, this parotid. Okay, but now the main is the deep lobes. So गर्दन आप थोड़ी सा झुका लें और इधर कर लें. Now with the pulp of our fingers, this is submental, we roll it, and this submandibular. So these are level 1. Submental and submandibular is level 1. Then at the angle of jaw, which is level 2 or upper cervical. Then along the sternocleidomastoid, in the middle part is the mid cervical or level 3. This is the lower cervical, level 4. This is level 5. This is level 5 in the posterior triangle. Now on the opposite side, इस side पे सर ज़रा झुका लें. We perform the same submental, submandibular, upper jugular, mid jugular, lower jugular, posterior. अच्छा, कंधे ऊपर करें. Shrug the shoulder and check the supraclavicular. This supraclavicular also come in level 5. The level 6 is the tracheal. This is the picture which shows different levels of lymph nodes in the neck. And level 7 is the mediastinal. So you should all know these different levels, and while palpating you have to tell which level you are examining. At the end, we will say thanks to the patient.
आपका बहुत बहुत शुक्रिया. ठीक है.
It will conclude our throat examination. Thank you.